So thinking of topics, issues, or events in planetary health, what do you feel is important in the next coming months or year?
I work at the international level for a lot of this. Policy making, governance can happen at a variety of different levels, but what I focus on is kind of more of the macro governance perspective. And what I'm currently seeing is that there is a very, very large disconnect between what's happening in, say, Geneva, in New York, in DC, and local communities actually implementing practice. So we have things like the international health regulations, these big governing bodies that aren't user-friendly and aren't user-friendly documents in any capacity. I would say the same for the United Nations Framework Convention on Climate Change, the Convention on Biological Diversity. All of these are kind of big macro negotiations that haven't really been translated down to the public, so the public doesn't really understand what they are. I mean, the amount of citizens around the world who are probably citing the international health regulations is not that many. So at the same time, as we're doing these amendments, revisions, say the new pandemic preparedness treaty, for example, I think one critical aspect is going to be actually engaging the public in a way where everyone can understand what's happening in these negotiating bodies. Because that's how you get people engaged. That's how you get people inspired and encouraged to believe in multilateralism in the first place, because they recognize that they're being actively influenced by it. When you just have these negotiations behind closed doors and in these, kind of higher income, higher perspective locales, you're not engaging the bodies that are going to be directly affected by the outcomes. And what we've seen so far is that when you do have that kind of civil society stakeholder engagement, it actually influences political backing and political support for multilateralism, multilateral institutions and conventions. So I'd say that's one of the places where planetary health, I think, is really going to shine in the coming months. I think we're really going to start to see civil society actors really want to be participating in a new lens, and I think it's really going to help push the planetary health political agenda forward.
What do you like about the planetary health framework? What really resonates with you that you'd like to call out?
It's funny, I've talked with Sam about this actually. The thing that I love about the planetary health framework is that there is so much of the world that already encapsulates the framework, even if it's not exactly called planetary health. So we already have so many policies in place regarding health, regarding the environment, regarding human rights, regarding national security, regarding all of these different regimes that already have the planetary health framework integrated into them. And we're seeing that with the interaction between kind of these different fields. I mean, we're looking at the climate change advisory opinion requests that just went to the International Court of Justice and the International Tribunal on the Law of the Sea. And we're starting to see that under the underlying foundation of the planetary health framework is already so crucial to so many of the bodies that govern our lives. So planetary health is already rooted in the integration of our society, and now we're having the opportunity to actually grow it, develop it, nurture it, so that it can be the leading force to promote physical, mental, spiritual, social well-being going forward.
What's a message about planetary health that you'd like to share with the world?
I think when people that don't know planetary health hear the term, there's a bit of a dissonance there. That word planetary, that's a big term. There's a lot going on there. Yeah, exactly. And I think it throws people in some ways. So the message that I would convey is lean into the discomfort that adopting a planetary health mentality might have for you.
What are the visions that you have for the future?
We should not shy away from the globalized world that we exist in now. We should actually, in my opinion, embrace it. Because we have never been, in my opinion, at a better time in society to recognize that our neighbors aren't just the people who live across the street. Our neighbors aren't just the people who live in our state. Our neighbors are not just the people who live within our country's borders. Because of the digital age, because of social media, because of the fact that we can fly around the world, we have the opportunity to truly move societal well-being past national boundaries, which is very aligned with the planetary health concept.
What are the barriers you're facing or challenges you're finding and running into?
I think one of the barriers that we are currently seeing is in adoption of the sphere mentality. That we are kind of forgetting the things that bind us together and allowing fear of what might be to break us apart. And that's where I feel actually really inspired by the planetary health community. The planetary health community is some of the most loving, vulnerable, authentic, and interconnected people I have seen in my entire life. They remind me every day of why I want to be in this field, and they remind me every day that regardless of the way that you kind of help to move the planetary health framework forward, you are doing it for the reason of wanting to move these hopeful spirits and aspects along. You're wanting to move kindness, trust, solidarity, camaraderie. You're moving all of these things together because you truly care and love for the people doing it with you. And it sounds tacky and cliche, but love beats fear any day of the week. And it's something that is tattooed on the forehead of every single person working in the planetary health field. Regardless if they're working on the ground in local communities or if they're working on international conventions like I am. When you come from a place of respecting the people around you, caring for the people around you, loving the people around you, and wanting to help the people around you, the barriers of fear, hate, distrust, shame subside. Because, like I said in the last question, doing global good is a universal human concept. So while these barriers do exist, and I think they're becoming far more prevalent as these abstract crises continue to affect us, I haven't lost faith in the concept of caring for others and using that care to move well-being forward as a result of the planetary health community. And I have them to thank for that. And that's why I love being a part of this space and look forward to continuing working in this space.